everyone, welcome to Cancer Healing Journey Talks. Myself Shruti Dapke from Community Outreach Team of Zenonco.io and Love Heals Cancer. Cancer Healing Journey Talks helps cancer survivors and caregivers to share their journey with vast number of survivors and caregivers who have traveled or been traveling through this journey. This can inspire and motivate them for their faster recovery as well. Firstly, I would like to introduce today's speaker, Mr. Pattrick. He's a lymphoma cancer survivor. I'm happy that you're here with us today to share your journey with us. Over to you, sir. Please start with your introduction.
Hi, Shruti. And first of all, thank you for inviting me to be here. It's a nice feeling to be able to share some of my experience and see your platform and maybe share some of my experience, and maybe other people can be comforted by it that might be going through the same thing or help deal with their own illness. But my own story, you asked. My story goes back a ways. It was first in the year 1990 that I was diagnosed with lymphoma. This came about by me observing that I had a lump on the base of my neck, and going to the doctor to begin to understand what it was. I do want to say in 1990, I was still living in California in the US. I'm now a longtime resident of the Netherlands and Western Europe, but so this all happened when I was still in California. So I got a lump. One thing led to another. I got a biopsy to confirm what it was, and I learned the news that it was lymphoma cancer. You were asking, to some of the reactions. Well, I was pretty young at the moment. In 1990, I think I was 24 years old. I had been out of university at that point about 2 years. And I had spent most of my life at that point playing organized athletics. I was a student athlete, even played a bit at the university level. So I had always been quite of a fit person, as a young person. Yes, I experienced many injuries, but they tended to heal very quickly. And so at the age of 24, this happened. It was a shock. I had been living relatively healthy and exercising a lot, had been athletic, didn't have many habits that would have increased my risk for it.
We never even think of it, like anything.
I would have never thought about it. Nobody in my family to this day has had cancer. So, there wasn't a family history there. So I was quite shocked. And of course, my family was quite shocked. I come from a family of 4 siblings and I'm the oldest. So for my parents to feel like, oh my, our firstborn and my brothers and sisters to feel like, oh my gosh, our oldest brother has this. It was quite shocking for everybody. And I went through a period where I was quite sad about it. The diagnosis went further. Eventually, the tumors were also found in my spleen. This was found through a splenectomy. And again, because we're talking about the year 1990, the way to remove the spleen at that time was just, I have a large scar from the top and bottom of my stomach area. I think it's done a little bit differently these days, using things like orthoscopy.
Yeah, many things have changed.
Many things have changed in the last 31 years. So after that, the treatment recommended for me was to go through radiation. And I don't remember exactly how long the radiation was. I want to say it took about 10 months, but that I was actively under treatment of the radiation for about 6 months. There was a period of time where my white blood cells got too low. The things that they were measuring in my blood just showed, okay, he's getting tired. His body is fatigued. He needs a break. So effectively 6 months of treatment was administered over 10 months of time. Now, I want to say that during this time, I think because I was young, because I had lived this athletic, fit life, I had dealt with the cancer at that time like something on my to-do list. Once a week, I need to go to radiation. you know, and the radiation was from about, you know, would go from my jawline down to the top of my groin area. And so there was a little bit of hair loss. There was a loss of moisture in my mouth, which affected my ability to taste and swallow food. I was still in the US, so I think about my weight loss still in pounds. I went from 210 pounds to 169 pounds at that time. And along the way, it was friends that saw my weight loss that started encouraging me to eat, you know, right. And they would come by late at night where I was living and say, you know what, let's go get you some food. What do you want to eat? And at that point, I would just, you know, say, hey, let's go get some cheeseburgers. You know, let's go try to eat some junky, tasty food that's going to feel nice to eat. So I had a support circle of some friends and family. If I'm not mistaken, this was a long time ago, but I think it was my mother that used to take me to the weekly radiation treatments. But I want to say, again, because I was a bit young and because of my history at that moment of being able to recover from injury quickly, I maybe didn't take the illness as seriously as I should have. Because throughout most of these 10 months that I was being treated, I continued to go to work. I continued to go to my job from 9 to 5 or whatever it was. Now, I was losing weight during this period. I did have lower energy. You could see that something was happening. I want to say to a degree that maybe I was in denial, because the day...
Denial of exactly what?
Well, again, I think I was just trying to minimize the effect of it and not really accepting what was happening to my body and the seriousness of it. Because as I said, I kept going to work. I kept going to the office during this time. And I went to my supervisor in the very beginning to explain what was happening. And I said to my supervisor, you know what, I'm telling you because you're my supervisor and you should know, but I'm also telling you, I'm also asking you not to make this a big deal in the office. I don't want people coming to me to talk to me and saying, oh my gosh, we're so sorry. Hey, we heard this.
The sympathy, you didn't want the sympathy,
I didn't want the sympathy. I just wanted to move on and continue with my normal life as much as I could. Visibly, people could see something was happening to me. I was losing weight. I was weaker. There were periods of time during the 10 months I would have to tell my supervisor, hey, you know what, actually, I'm quite tired. I'm going to need some time off during this week. But I kept trying to work as much as I could during those 10 months. And just, like, as I said,
I think that helps to, like, your focus from cancer, like being a cancer patient, the focus shifts because of the work, I think.
It could be that it was a way to deal with it, to maybe distract myself. You know, so that was in 1990, and then these 10 months of treatments actually bled into 1991. And I remember having conversations with the oncologist about, you know, now we'll just sort of monitor you every year. They did have to put me on medication. They found quite early and expected that the radiation would affect my thyroid levels. So I had to start taking thyroid medication daily ever since 1991. But then it was just an annual checkup that we would do, right? And the oncologist mentioned to me, hey, look, the 5-year survival rates for lymphoma are like this. And so if you get past 5 years without a reoccurrence, chances are pretty good, 80, 90%, that you'll never have to deal with this again and you'll be cured, right?
Right.
Well, 6 years later, in 1997, I experienced, I couldn't stop coughing. I had a really bad cough. I thought I was just sick at first, although it was so frequent and very hard. It was the worst cough I'd ever had in my life, but it lasted like 3 weeks. And so finally, I went back to my general practitioner in the US, because I'm still living in the US. And I get referred to an oncologist. different oncologist. The one that had treated me in 1991 had retired. So I get referred to another oncologist, and he's touching my body, and he finds a lump in what they call the ancillary area, basically your armpit side of your chest muscle. He finds a lump, does some x-rays, and comes back and says, you've got, your general practitioner thought maybe you had pneumonia because of the way you're coughing, but what it is you have water on your lung, not in your lung, but against it.
Okay.
And that's causing pressure, and that's what's making you cough.
Mm-hmm.
And, so one thing leads to another, and the doctor tells me, look, we can relieve the cough a little bit now by performing, what do they call it? An imperial, what do they call it? It was a spinal tap. They literally put a needle through my back and sucked the fluid out.
Okay. For the reports or something?
Just to really create the relief, I had this, to relieve the coughing and relieve my body of the pressure that was building up on my lung from the fluid. They drained it out through my back. I forget the clinical term they call it. I think it's colloquially known as a spinal tap. Then I had to do another biopsy and to actually remove the tumor. And because this was my second occurrence or a reoccurrence, well, then I was given the chemotherapy.
Okay.
And this was 6 years later. So now I'm about 29, 30 years old. It's the second time. I thought I had passed the 5-year survival rate. So I dealt with it much differently. I dealt with it much differently.
Can you please tell us how different?
It was like a wake-up call that maybe I hadn't faced this seriously enough the first time. My body hadn't been able to be cured of it or remain in remission. That I just maybe hadn't faced it. I was trying to tell the story before that I made it as a kind of to-do list. I even kept going to work. Maybe I didn't let my body rest as much as it needed to. So when I got the recurrence, I had a 180. I went to work or contacted my manager the next day, told him what was happening, and I just said, I'm going to stay home and deal with this.
Right.
I need to do chemotherapy every week. I don't know what it's going to cause yet, but I'm told it will probably cause some nausea, some malaise, where I just feel exhausted. There'll probably be more visual effects on my body that you can see. But I took a different approach that time and said, I need to just let my body deal with this. I need emotionally to be able to deal with this.
Right.
I just don't have the focus or the motivation to be my best at work right now like I did before.
Yeah.
Before it was like, it's another thing. My body always recovers. I'm just going to keep doing what I do because it helps me feel good. And this time it was like, I need to think about this. I need to relax. I need to rest, let my body deal with it emotionally. I feel worried about it.
Yeah.
So I didn't go back to work. I stayed at home. I guess you could say what they call in the US, I was on disability. And because I was home, then the support was still there, but because everybody saw the condition I was in emotionally at that time and not even going to work, then my family, my friends came to visit me much more often. I think in the first time they let me be because they saw I was just kind of moving on with life, right? But this time I was taking a complete time out. And so my family and friends would come to visit me quite often. There was a period of time, I think, again, where my white blood cells dipped during the chemotherapy. And I have a sister who was a pre-med student at that time. She would actually administer the shots to me at home for the white blood cell boosters. So that would be kind of the part of the thing. And we would come home, we would eat together, we would watch movies, we would play video games, and so the support was different, but also the way I dealt with it myself mentally that time was a lot different. And physically, I mentioned the weight loss that I went through the first time on radiation. because I didn't have the same effect in my mouth with the loss of moisture, I actually didn't really ever lose my appetite.
Okay.
So
the taste?
The taste and the moisture in my mouth. With the radiation, it kind of knocked out the function of my saliva glands a bit.
Oh, okay.
With the radiation in 1991. So with the less moisture in my mouth, it made it hard to eat. It made it uncomfortable to eat. I couldn't taste the food. So that was part of the reason why I lost so much weight. I wasn't eating so much. But when the chemo happened, I didn't have that sensation in the mouth. I could eat normally. And in fact, I did. And I think I even splurged on a lot of foods. And so I stopped going to the gym, started eating more fatty foods to feel good. I actually got a little bit heavier.
Okay.
A little bit fatter. And, you know, I had one of the common side effects. At a certain point, I started noticing my hair falling out. I was in the bathroom one day, getting ready to brush my hair, and it's falling out, right? And I knew to expect it as a possible side effect that I would lose my hair.
Yeah.
But I decided, you know what? I don't want to just watch my hair fall out. If it's going to happen, then I want to feel in control of it. So I think I went the next day to a barber and I said, cut it all off. Let me feel control. If people are going to ask what happened, I can deal with it this time. I can talk about it now.
Yeah.
Not like I did when I was on radiation. I can
this
talk
time
about
I
it.
think
I can accept it.
Yeah, I accepted it that you have cancer, right?
Yes. And however minimal the token it might be, shaving my hair instead of waiting to just watch it all fall off and feel sorry for myself, I just thought, let's go. Let's get rid of it. Let's take it off. I'll wait another day to see when it's ready to grow back. And then, you know, once or twice a week, I would have to continue shaving my head. It was during this time, one of my best friends from high school got married and he asked me to be his best man. So there I am in his wedding pictures to this day with no hair. So there's some souvenirs there for that. So what I could say, Shruti, from that time is, very fortunately, since 1997, I have not had a reoccurrence. I remember speaking with my oncologist the second time and asking, okay, so do you think I'm cured this time? Do you really think I'm cured? And he said something that sticks with me to this day. He said, you know, we won't ever really know. If the day comes when you pass on and you pass away and it never came back, we'll know you were cured. But for now, the tumors are you still have some tumors in you, but they're in remission. Right. And so I've been in remission since 1997 is what I say. And, you know, we'll see. Someday we'll see. Well, whether that can be said if I was truly cured. Yeah. But I like what the doctor said. I like what the doctor said because it also left an impression with me that continues to motivate me to live the healthiest life that I can. Right? That
yes.
I don't know how to say this, but maybe I don't trust myself that if I feel cured, I might just kind of like, okay, good. Well, nothing else I need to do. It's gone.
Yeah. Then you won't take care of yourself, you mean?
I think I might get a little complacent, a little too comfortable.
Maybe. Yeah.
You know, but when I feel that I'm in remission and I've already had one occurrence, it's a kind of constant motivator, if you will, for me to live as healthy as I can.
Yeah.
Take care of my body. I'm still physically active. I'm now in my mid-50s. I'm still very physically active. I'm doing things now in my 50s that I couldn't do in my 20s and 30s, you know. Now, some of it has to do with understanding technique better about the sport that I do and understanding nutrition better yeah, well, I said nutrition, but and technique and rest, you know. So it's not just somehow my body got better. I am smarter about it, and I could say, you know.
Yeah.
And some of the physical endeavors that I do, I'm better in my 50s than I was in my 20s and 30s. Wow. But so it's been a constant inspiration for me to continue to live as healthy as I can. And there were moments the second time I was dealing with the lymphoma and that I was feeling very ill from the treatment, from the chemotherapy. There were times I was very uncomfortable and not happy, right?
Mm-hmm.
I don't know if I could say I was depressed, but I was really just not happy.
Yeah.
That's probably a good way. So there were moments in that time where I said to myself, Shruti, you know what? Any day that I live in my life where I feel this way is one day too many.
Mm-hmm.
And so again, it's a kind of motivator to myself to live as healthy, but live as happily as I can. If there's something in my life that I'm not happy about, then I should do something about it, right?
Yeah.
If I see something that triggers something in me, I should say something about it. You know, it is a kind of constant motivator for me on how I live my life, and you know, I would say shapes the kind of person that I want to be.
Yeah. So, do you think cancer has changed you in a positive way?
Yes, yes. You know, I think the things that I just mentioned to you
Yes, they were quite
certainly
positive.
has certainly given me a sense of perspective.
Yeah.
You know, especially after the second time,
Mm-hmm.
it really gave me a sense of perspective. Maybe you hear this a lot from survivors, but it made me realize how precious life is.
Yeah.
Just in the sense of being alive, but then the life that we live. You know, it gave me a very different, another sense of perspective. And um, you know, people that have come to know me well, Shruti, um, will often comment to me, you know, it's amazing how disciplined you are. As I've been growing up, my life has continued since the treatment in my 40s and 50s, the discipline that I have to live a healthy way by what I eat and by how I exercise, you know, people normally say, you know, he's very disciplined. He makes a program and he goes. He lives it as part of his life. And certainly my experience with cancer sort of heightened my interest and my dedication to living as healthy as I can. And the reason why I'm talking to you today is also giving me that appreciation for preciousness of life has given me more empathy to other people that are dealing with illnesses. Right. Whenever I hear of somebody that is going through cancer, dealing with cancer, it's a trigger for me to open up and say, hey, you know what? I've dealt with cancer. I've had radiation, I've had chemo, and we can share things about it, you know? So it's opened up also the empathy to other people that are dealing with illness. Normally it's cancer, but it can be other things as well. You know, just generally, if I meet people and someone in their family has been hospitalized, I can empathize with that feeling of a loved one, a cared one, being ill and needing treatment and needing care. So it also expands beyond cancer sometimes. But okay, are we on?
Yeah, go ahead.
So you've noticed that I talk a lot about health as a interest of mine in my life, and something that I've sort of gotten more discipline from as a positive reaction to the cancer. You know, what I would say is exercise what everybody should do. I think it's what worked for me. You know, this was a health issue. And so what helped me with the heal was to rebuild. And I got this idea in my head that even though I've been treated for cancer twice, I'm going to recover even better than I was before. I think maybe that would be the positive message that I would share to people is think about becoming a better self, better version of yourself in some way. Yeah. And what will that be? For me, as I grew up playing sports and was an athlete up through the university level and was, you know, I've always been a kind of gym rat, you might say. For me, that's where that focus got channeled. Right. Right. If this is really a health matter about my body, I'm going to continue to build my body even better than it was before, despite this setback. And I think for every person, whatever their interest is, you know, this can be a motivating force. How do you survive it? How do you overcome it and even become better at something despite this setback? I think I'm the kind of person that is really motivated by overcoming challenges and feeling successful when I can, when I reach them. And maybe some of your other viewers are like that as well. So find the thing that for you will say, despite this, I overcame it. And it might be reading more books. It might be going back to school, being smarter. You know, it might be getting out and reconnecting with your friends and family more. It might be seeing more of the world now that your life has continued, whatever it is. You know, I think living it better to some degree now that you've hopefully gained the appreciation on how precious life is. You know, I think that's what I would say. It happened to be exercise for me. It was a natural extension of who and what I am, and there were many dimensions where I could explore that, not just in frequency of exercise, but how, and as I mentioned before, the technique, and then how does nutrition and what I eat and how does my body weight affect how well I can perform and sleep and these kind of things. It just opened itself up to more to sort of becoming my lifestyle, and that's what worked for me.
Right. So when we hear that we are diagnosed with cancer, many people don't go for the treatment because they think that they have cancer means they'll die. That's why they don't go for the treatment. What would you suggest?
Wow. You know, it's been 31 years since I was first diagnosed.
Yeah.
We can all think of the electronic things that have changed in the last 31 years. Think what you can do on a mobile phone now that you couldn't do 31 years ago. But all the technology affects medical care, healthcare as well. You know, so being diagnosed with cancer today, I don't think faces the same risk. Let me put it positively. I think being diagnosed with cancer today, I think the outlook and the survival rates are even better than they were before.
Yes, that's
because of things like technology and nutrition and the types of healthcare that are out there. I don't think it's the same. In my career, I actually did work for 2 years at a company that was providing diagnostic services for breast cancer patients. And I learned a lot working at that company. When I was diagnosed in 1990, the common way of categorizing, staging your treatment had to do with your gender, your age, where were the tumors found, you know, above the diaphragm, below the diaphragm, and then you were kind of lumped into a group of people. Okay. You were lumped this way to say, okay, these people that are this age and that are men that have tumors this size and this many tumors spread out this way in their body, we're going to call them this, and we're going to apply this treatment protocol to all of them the same.
Right.
What we've learned since then through molecular diagnostics is that how individual bodies will respond to cancer is very much determined by your DNA. So yeah, I feel with the advances in technology, with things like molecular diagnostics, there is the possibility these days to specifically diagnose cancer and personalize the treatment based on just how your own body composition is made. That I would share that with people that are being diagnosed with cancer and are skeptical about getting treatment. One of the other positive things, Shruti, I would say, is that I have become much more aware of what is normal for my body through this process of dealing with cancer. And it means, you know, I am probably my general practitioner's favorite patient. I say that because I'm probably the one he sees the most, because anytime something goes wrong, I want to know why.
Right.
You know, I am not one of these people that is afraid to go to the doctor and just goes when things are really, really bad and then there's no hope. I take seeing my general practitioner as part of my health maintenance. And so anytime something is out of normal for me, whether it is temperature,
Any small things, right?
Anything.
Yeah.
You know, because I had lymphoma, it affects my immune system. So if I get sick for too long, I'm at the doctor's office saying, hey, what can you give me something, you know, an antibiotic if it's a virus or something.
Right.
But I'm in my doctor's office at least once a year, if not more frequently, anytime something just seems off with me, you know. So I'm quite the opposite. Some people are don't want to go to the doctors because they don't want to deal with the bad.
Scared mostly.
When you do that, you make it harder for your body to recover in case it needs it.
So what are the 3 life lessons you would like to tell us?
Yeah, 3 life lessons. I mean, you've probably heard it through the things that I'm talking about so far. I think the first one of the life lessons is healthcare management, taking care of our bodies is up to us. It's not the doctor's job to take care of our body. And you can't expect a doctor to make you suddenly well if for 6 or 7 months or a year you've been dealing with some illness and letting it progress and you've just been ignoring it. So I think one of the lessons is dealing with managing our own health and how we play an active part. I think secondly is, you know, having a support circle, having good relationships around you, friends and family, is very important. There will be difficult moments in life, like cancer. And sometimes we're tough enough to get through it on our own. And many times we're not. And having that support circle that can continue to push you is very important.
Yeah.
And I want to touch back on something you were saying, that you said sometimes people get diagnosed with cancer and they don't go to the doctor because they think that's it. It's a death sentence. What I would say to people is, think about surviving cancer. That's been one of my lessons. Cancer doesn't define my life. It doesn't define who I am, but it is part of my life journey.
Right.
And to this day, even though it was more than 30 years ago that I was first diagnosed with it, it has shaped who I am today, I think in a positive way. But it doesn't define what I am. It hasn't defined my life. I do that. We do that. And so overcoming it is really, really up to us.
Right. That was amazing. And if you have to sum up your journey in just one line, what it would be?
To summarize my journey?
Yes.
Wow. That's a difficult question. Well, I think I would say figure out who I am, right? If I was into sports and going to the gym before, it made that more important to me. It heightened the positive things about me. That is what this journey has been about for me.
Right.
You know, maybe that's how I could summarize it.
Yeah. Thank you for your valuable time. I'm sure this session really motivates people out there who have traveled or been traveling through cancer. It was lovely having you here today. Once again, thank you so much.
Thank you, Shruti. It was a pleasure to be here. Thank you so much.